Well, hello there. I'm Gregory, now with University of Texas Medical Branch, but recently a part of Duke and U.S. Medical School. And I'm here to talk to you a bit today about emerging respiratory threats. I call this basically future threats that might cause pandemics and what we need to think about. Again, I'm now in Texas and I'm in a rental, so excuse the informality of the presentation. I'm sorry I couldn't be with you there in Singapore. I have a few financial disclosures, but I won't really be talking about any of their work in this presentation. First, this morbidity with this pandemic has been tremendous. I mean, unprecedented, despite, all our modern public health interventions and therapeutics and all, we're still suffered, just unacceptable numbers of cases of infection and deaths. It's just terrible. So we need to think about ways to prepare better and investing in those ways so that we can anticipate these and not just work to respond. Julie Gerbening, former head of the CDC, puts it this way. We have a problem in that when biothreats are recognized, policymakers do allocate emergency resources, but once the crisis fades and public attention subsides, investments drive up, attention shift, and a false sense of security takes hold. I sort of call this the whack-a-mole pandemic response strategy. Wait for something to happen, then we jump on it. But wouldn't it be better if we could anticipate it and jump on it before all the morbidity and deaths occur? Well, let's think about, there are many kinds of emerging threats. Some are vector-borne, some are enteric, like cholera. Some are, caused by other different pathogens. But the ones that catch us and surprise and spread most quickly are those that are of respiratory virus origin. And I would argue that we should put much of our surveillance in these areas. So in this review paper, we looked at where those epidemics have caused severe disease. What are the viruses that have caused us big problems? Some pandemics, of course, they include influenza and now coronaviruses, but also we argue that enteroviruses and adenoviruses and paramyxoviruses should be considered as well. We work from this model here for zoonotic pathogen detection. The idea that, maybe 70% of these emerging pathogens come from animals, everybody seems to embrace that now. And that, they gain a foothold in humans and cause pandemics. But what is not recognized is that this can take dozens of years. And we have time, if we do surveillance at the human-animal nexus, to pick these up before they fully adapt. It's more than likely viral evolution would argue that it's incremental changes in the virus that we would be looking for, and instead of just waiting for the onslaught of morbidity to come into the emergency rooms. So if we conduct surveillance in people that are intensely exposed to animals and their animals, and we see a virus beginning to take hold, maybe limited transmission to humans, that's the time to intervene. Now, we don't want to wait till it's out of control. And I say that because there's really strong evolutionary data to suggest that this takes a long time. This is one of the early papers. There are now other papers showing ancestors for SARS-CoV-2. They branched off, as far back as 1969. So it doesn't happen overnight, like you see in the movies. We have time. We just need to conduct surveillance. Well, how do you do that? How do you do that efficiently and at sustainable cost? Well, there have been a number of efforts, and some of them very broad, some untargeted. This is one such U.S. effort called USAID's PREDICT program, and they've invested some $200 million since 2009, especially looking at animals to try to anticipate what viruses might spill over to man. And they've collected a lot of biological specimens and identified a lot of viruses, but they've been criticized. Like, well, what does this mean if you find a virus in that bat? Is that bat ever going to contribute that virus to humans? Or what about in in an alligator in Florida? Well, maybe we can do a better job, a more focused surveillance system. The relevance of detecting a virus in an animal is in question here. Other strategies have been to deepen our knowledge about existing pathogens that have already spilled over. And we do this with various centers of excellence for influenza, and now these new centers with NIAID looking at emerging infectious diseases. Two of which, by the way, have been awarded to the University of Texas Medical Branch, where I am now. But I would argue that the wildlife pathogen discovery focus is not perfect, and nor is the known pathogen focus that the CDC and NIH have embraced. And what we need is something in between. I mean, these things are good, but we need something in between, and we've called that the One Health discovery focus. We need to really get out there and find out what viruses are beginning to adapt. And it's a great data reduction strategy. Instead of looking for every virus in the world like the Global Virome Project suggested, let's spend our money in very target areas that yield viruses that make a difference. So anyway, the strategy is the human-animal nexus, and this is being embraced by others like Eddie Holmes' group in Australia. We need a more targeted, arguably more productive approach to focus our sampling on. And he says the human-animal interface is the ticket. Well, if we were going to do this, where would we have the highest probability of successful detection of novel viruses? Well, historically, there's some evidence where we've had big epidemics of respiratory viruses that are animal reservoir, where these occur and what kind of animals they occur in. And so we're not totally data blind. Here we recorded this, some of that morbidity in this review paper for 5 different respiratory virus families. And you can go online, I'll talk more about this paper, but basically we think we have some data-driven, data reduction strategies that will reduce costs and yield viruses that are worth studying intensely. Well, let's look at the influenza viruses. What do we know? Well, we know that there's potential that canine influenza viruses could spill over to man, but frankly, we haven't seen any. What about equine? Yeah, we've seen those. We think that they do spill over to man. There's historical evidence. We've even, with feline, we found an isolate actually in a cat-exposed human. And of course, there's avian flu in humans. We've seen that. But much more commonly has there been swine influenza spillovers. So if you look at the species barrier, it's lowest, we would argue in this paper, at the swine-human interface, and we should be doing surveillance where we can at that interface particularly. In a similar fashion, we can look at the coronavirus species barriers, and you can see at least where the novel generation of coronaviruses have often occurred. And again, pigs have been implicated. In fact, the pigs have suffered markedly by the emergence of new pig reservoir coronaviruses that have caused big outbreaks and much morbidity and subsequent costs to the businesses in the pig world. Fortunately, as far as we know, these are not spilling over to man, but as we know, well, recently there's some data, the papers coming out that a a Delta swine-like coronavirus has been detected, a live one in humans. So the potential seems real. And if you ask me, where should we look for novel coronaviruses? Well, pigs and cats would be something I'd be concerned about, and of course camels with MERS and et cetera. But anywhere we have a large population of an animal that's a reservoir and historically generated emergent viruses, it seems prudent to do surveillance. So we're not going in blind. Basically, in this paper shown here in viruses, we've identified the 5 viral families we think makes the most sense. And we've developed, in partnership with our veterinary colleagues, algorithms combining conventional PCR with real-time PCR and looking for novel viruses that shouldn't be, for instance, in human hosts. Did you know that the diagnostics you see even in your best hospitals would miss a novel coronavirus from dogs? They're just not tuned into that. So you have to have tools like these and do periodic surveillance, for instance, in patients with pneumonia to make a difference. Well, we've had these, developed these algorithms, and they work pretty well. We've been training others to do them. In fact, in this paper, there's some 39 pages of detailed information online should you want to adapt some of these techniques and looking for your own novel viruses in the patient populations you serve. We've been commissioned by US government to go into the developing world and help them bring up these diagnostics at places they think where spillover could be occurring. We've conducted workshops, and then they've taken these diagnostics to the field, and it's been a lot of fun and rich for us experience. We think that there are 2 strategies that are most relevant and high yielding. One is an animal worker network where you study people with intense occupational exposure to large populations of animals. Think of swine workers, live bird market workers. Think of poultry workers. I think of cattle workers. And we do surveillance in those animal workers and their animals looking for spillover events. Now, sometimes you can't work in those settings, like in the United States, with all the autonomy of the industrialized agriculture. It's very hard to get their cooperation. They're afraid that we might do something to damage their business. And so an alternative strategy that's working pretty well is to go into the same high risk areas where there's large populations of animals for meat production and do pneumonia etiology studies. So when those workers come to the hospitals or their family members, what kind of viruses are causing that hospitalization? And we sort of talk about this strategy, looking at the animals and the humans and even the environment as the One Health approach. This has been defined a number of ways. I like this AVMA definition. It's a collaborative effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and our environment. And I'll just say that this strategy is getting a lot of traction internationally as a way forward when you have these complex medical problems like zoonoses. Well, you might benefit from some of the work Predict has done in saying, well, where are you most likely to see an emerging threat that comes from livestock? And so here's a graphic that you can find online. We have benefited from that in the sense that we've set up surveillance at the human-animal nexus in red here in a number of different countries in recent years and partnered with them in adapting these techniques, looking for novel viruses that are beginning to have a foothold in humans. And a similar, these are fun in that you learn a lot from veterinarians. You know, veterinarians see the world and serving, they serve populations of animals. Humans often think one-on-one, the doctor, the clinician, and the patient. And so it's fun to bring new technology like aerosol sampling to our veterinary colleagues and to go to the places where they think the public mixes with the animals and to learn from them and help them set up surveillance to find evidence for spillover events. And sometimes we get lucky and get funded by the big agencies. This is a R01 that I won with Dr. Chow in Beijing Institute of Microbiology and Epidemiology in China, where we prospectively studied swine workers and controls, their pigs, and the environment, aerosol, fecal, environmental swabs, and water samples. In some cases, I think it ended up about 10 farms over 4 years. And it was a lot of fun. We worked closely with the provincial and large city CDCs. The pigs didn't mind, and we found a lot of evidence of mixing going on here. And basically, there's so much influenza virus in these settings, and so much mixing going on with not only the pigs and the humans, but the passerine birds, the chickens, the ducks, the geese, the dogs that are all part of these large farms that you almost cannot escape mixing. And if you're an animal worker, you almost cannot escape being infected with whatever emerging virus is in those pigs. It's just a big viral gunpowder keg when a new virus gets in there, and there's not a lot of existing immunity in the pigs. It just churns, and the viremia in the pigs, the viral exposure to the humans is intense. We've also been funded by the U.S. NIH, NIAID through the Fogarty Centers and providing training. This program is over now, but we had a D43 program for innovation that was very successful. Young scholars, human health, animal health, environmental health, gathered together for joint training, and work in Mongolia on their zoonotic problems, and generated more than 25 papers so far in the scientific literature of their discoveries. It's a lot of fun for them working together as a team in settings in this rather austere environment with a lot of human-animal interface and zoonotic morbidity. So where we can't do those sort of One Health studies, we've fallen back to pneumonia etiology studies. In green here, you see where we've recently conducted surveillance or are conducting surveillance among patients that are hospitalized with pneumonia. And basically, we do nasal swabs on these patients, and we look with those pan-species diagnostics, the algorithms for novel viruses. And sometimes we've set up the first viral diagnostics in the countries, and it's greatly appreciated. Can you imagine a big 700-bed hospital with no way to diagnose even influenza? Well, that's what we've seen. And when we can help them get thermocyclers and positive controls and to these, and train their laboratorians, it's been very effective. And in fact, sometimes this has been very useful when SARS-CoV-2 hit. These same hospitals could pivot and support the ministries of health because they had the molecular equipment. And setting up these labs has been fun. We've gone to really rural settings, deep in the jungle of Borneo, for instance, at Kapit Hospital, helping them have the first viral diagnostics. And not only now can they look for respiratory viruses, but dengue, chikungunya, Zika, amyloidosis, leptospirosis, etc. We've helped them adapt diagnostics there, and also in Cebu, a big middle city in the state of Sarawak. And not only do we benefit from our partnerships with international scholars human health and veterinary health, but we also partner with environmental health professionals. I'll just say that in my medical training, we were not heavily introduced to these folks, except maybe pulmonary function tests. But they have a lot of tools. In fact, they have really good tools now that are proving very valuable with SARS-CoV-2 transmission, and we've adapted these in a One Health way to detect pathogens in the public areas as well as hospitals, et cetera. We've gone in with these air samplers into healthcare settings, into agricultural settings, into public settings like live poultry markets. We brought them into airports like associated with the Hajj, where millions of people go to Saudi Arabia and are mixed and often come out with respiratory infections. And even our local airport when I was at Duke, sampling the baggage areas, we're finding evidence of aerosolized nucleic acid from respiratory viruses. One of the more interesting reports is that we rode mass transit, the subway system in Singapore, during the morning and evening rush hours. And when you're chest to chest with a person in a crowded subway car, well, you can imagine it's really easy, despite good circulation of air, to share a virus that you're exhaling with the person you're so intimately in contact with. So these are interesting settings that we can use these tools without informed consent and get a handle on things. In fact, we've used them in bird markets. This is the Hy-Vee bird market outside of Hanoi, where they process and handle some and sell some 10,000 birds a day. And I'll just tell you that it is full of aerosolized live virus. You walk through there, you come out with a respiratory disease that's probably low-path avian flu a day or two later. And so these workers are intensely exposed to whatever circulating virus is in the poultry that they sell. And they can go home and share it with their family members if it's highly transmissible. We've replicated this study in China and even a small bird market right outside a high socioeconomic area in Kunshan. Again, finding live virus in the aerosol of these live bird markets. So this is a good place to do the surveillance. And we've taken these aerosol tools into the healthcare settings in support of SARS-CoV-2 epidemiology, both in Singapore and in the USA, and even brought them into people's homes for early disease detection and looking at the ecology of SARS-CoV-2. What can we do to stop it? And I'll just tell you, it probably doesn't take very many virons, and it's really hard to stop. Well, now, the other thing we've been able to do is think of ways that we could work with the agricultural industry that's non-threatening. I mean, one way is to use aerosol detection. You don't have to grab a pig, snare a pig, as we would say in the veterinary language, and damage or bruise it. Instead, you could just look at the air the pig is breathing. And you could get in a crowded pen, you could get an idea of what viruses are in the air through the dust and aerosolized feces. And we've done that actually in North Carolina, which is a big pig producing state. Ben Anderson led the study, and he detected incursions of viruses that cause epidemics in pigs 1 week before they knew they had an epidemic. In other words, he found it before they saw a lot of illness in the pigs. The pigs weren't feeding, et cetera, and then called the veterinarian who took the samples and said, you got it, These aerosol techniques are more efficient. They can cover large areas, and they can give you early warning. Now, another strategy is say, well, let's look at the fecal material. We're doing that, of course, with SARS-CoV-2 and polio on humans. Maybe we can do it in animals. And so Emily Bailey, both of these scholars are now faculty at different institutions, but she was a postdoc with our group. She won a grant to look at fecal material in North Carolina swine farms and look for swine pathogens. And again, this is a very good way to pick up swine pathogen because the pig fecal slurry is from many different animals. Now, the coolest thing that Emily did was we partnered with the Chan Zuckerberg Biohub, which is has a new strategy to basically use high throughput computers and next generation sequencing, put the data up in the cloud and hit it with a software pipeline to look for emerging pathogens. So this approach, in contrast to our other approaches, where you have viruses, specific viruses in mind, this is non-prejudiced approach in the sense that you look for anything that has nucleic acid that aligns with any microbe in GenBank, and it can quantify the microbe conserved sequences in a nice way. And so you can see bacteria, you can see viruses, you can see fungi, and you can see what's in your complex specimen. Now, it doesn't necessarily need to be feces. It could be oral specimens, nasal specimens. Some people are using this next generation sequencing, looking, your axillary areas and environmental samples, etc. So it's a nice tool. We're going to see more and more of this. But the Chan Zuckerberg has a really nice quantifiable approach, and they can give you these graphic depictions when you find a signal that is pretty prevalent, conserved sequence, and it doesn't align very well with existing, pathogens. In fact, it aligns with many. Then we see these fan-shaped detections, which suggest you got a new emerging threat. And I'll just say that we recently published this. It's pretty darn exciting because in just about 9 fecal slurry samples, we found evidence for 1,792 viral genomes, of which 554 were novel. And some have never been seen before. So you can read this paper, but the bottom line is there's a lot of viruses out there to be discovered. And this tool is a very powerful tool to detecting through metagenomics new emergent pathogens that may be spilling over to humans. Well, how do these One Health approaches work? Well, I'll just tell you they work pretty darn well. We found evidence for metahuman viruses spilling over between humans and turkeys, both ways. We found equine influenza in camels, shouldn't have been there, influenza D in chickens, a vampire bat adenovirus in humans, a feline adenovirus in humans, human enterovirus in pigs. But most recently, some other pretty cool findings I'll mention in a minute. But when you find these things, what does it mean? Well, you don't really know if it's a pathogen until you meet Koch's postulates, and you can't challenge people with ethically. And so we have to do something called Bradford Hill criteria, Falco's criteria. It's an incremental process to show evidence that that's truly a pathogen. And that takes additional studies. So just finding a virus in a human that shouldn't be there is not enough. You need to do some more work. And we have to call on our epidemiological or immunological partners. It requires some basic science. It requires field studies. Well, here's an example. Lishan Zhu was a PhD student in Beijing at one of the leading universities. He approached me and said, hey, I want to come work in your lab for a year. I got a scholarship to do so. And he did. And he came, and then SARS-CoV-2 came out. I said, Lishan, with all your molecular skills, can you make a diagnostic that would pick up every known coronavirus in the world? In other words, you get a signal. So he went to work on it. In one weekend, he had a semi-nested approach, and we ran it against a bunch of our animal and human coronavirus that we had in the lab, and then had to make some synthetic ones. And bottom line is it worked pretty darn well. It did not pick up any other viruses that we commonly had in the lab. So we started challenging or interrogating, if you will, archive specimens. And it's a long story, but we found the first ever canine coronavirus, a live virus, and specimens, patients with pneumonia in eastern Malaysia. This work was done by Anastasia Vlasova at Ohio State, a really good animal virologist. And now she's found some other viruses. So the bottom line is here, looking at patients with pneumonia in areas that are historically have emerging threats is a pretty good idea, pretty good data reduction, and it yields interesting findings. Now we need to go in and further study this isolate, and we're doing this with basic science partners to see how in the world this virus spilled over. What is are there other viruses occurring that we're missing in these same populations? How is it adapted to man? How transmissible is it human-human? Many things we need to understand, but at least we've caught it early. If this thing was a pandemic virus, we would know it by now. And maybe we can do something about it. Well, since we came out with that report, it turns out that others have found prior to and since other spilling over viruses, alpha coronaviruses, and now some delta coronaviruses. And so probably the coronaviruses are challenging humans periodically around the world, and we just don't know about it because we don't have the tools to detect them in the average healthcare setting. Got to use special tools. So anyway, I'm advocating today for using a One Health approach and attempting to mitigate pandemic threats. Doing so, we can save a lot of money, and it's more sustainable. We can engage multiple disciplines in problem solving. Often we need to do this in the developing world, and bringing diagnostics to them has immediate value in their care of their humans and animals. They like it. Instead of just taking specimens and running away, which is sort of the classic way we've done stuff. And the data reduction strategy just makes more sense than trying to study every virus in the world and every animal, and then have to do it again 10 years from now because the viruses are constantly changing. Anyway, thanks for letting me be a part of your conference. I wish you well. Unfortunately, I could not be there, and I couldn't give this orally in time because it's the middle of my night and would wreck my next day. But I wish you well in your meeting, and I hope you have good success.